LPR is the reflux of contents of the stomach reaching beyond the gullet, up as far as the back of the throat, and manifests as a range of symptoms, including sore throats and chronic coughs. It's quite a common condition that's been recognised for the last 10 to 15 years. Patients presenting with these symptoms often don't experience classic signs of reflux like heartburn, and so can be difficult to diagnose.
This is an extreme example of LPR. This gentleman had a body mass index of over 50, ate 6 pizzas a day and drank 3 litres of cola every day.
Okay, Del, so if you can just do that uh-oh and then 1, 2, 3, 4, 5 for me.
Uh-oh.
Lovely.
1, 2, 3, 4.
The treatment and management of LPR within Doncaster has been identified as a model of best practice that can be shared regionally and even nationwide. They've discovered that the diagnosis and treatment of LPR requires a cross-functional approach. ENT consultants and speech and language therapists are brought together to provide an effective patient-focused service across primary and secondary care.
Well, in Doncaster, the speech and language therapy service gets in with the patients right from the beginning. We're able to give them a reflux management training session. This lasts an hour and a half and they receive it 2 weeks after they've had their original diagnosis. That's given them time to come up with their questions, stop taking their medicine, all the things that they do that mean that reflux treatment is frequently unsuccessful in other circumstances.
The Doncaster model works effectively because of the successful coordination between healthcare professionals and the patients themselves, allowing the patient to take control of their own disease.
Our model helps us to reduce the number of unnecessary hospital outpatient attendances. I think our model helps to achieve that by cutting down the number of hospital visits, and also because of the step-down programme after treatment, in order that patients can stop taking most of the tablets that they're on within approximately 6 months. We're not burdening GP practices with long-term costs on their prescribing budgets.
Even when treated, LPR can take months to resolve, so empowering patients like Del to achieve better outcomes is vital.
Communication is a great thing, and I felt that they were communicating with each other for the best of the patient. And I think you need all of the different aspects working together to accomplish the final result.
The majority of our patients have some medical treatment, but perhaps the most important part of it is the patient advice that we give out and the training that we give to the patients in how to manage their condition in terms of lifestyle, diet, etc. For medical treatments, we usually use a combination of a proton pump inhibitor and an alginate preparation.
Scientists in Hull have not only established that LPR can be reflux related, but that pepsins or protein digesting enzymes may be a vital component responsible for tissue damage. For this reason, raft-forming alginates have a definite role to play in the symptomatic relief of reflux-related LPR symptoms.
Alginates are capable, if you actually select the right one, of actually suppressing reflux and therefore suppressing the damaging agents which are in the gastric refluxate, such as pepsin and bile acids.
Reckitt Benkiser is working to raise awareness of LPR and share best practice models nationwide.
Reckitt Benkiser are working with the NHS to develop services, to employ the quick principles of a quality service that's innovative, patient-focused, but is more productive. So we're using expertise to support the NHS to do this.